Hello, everyone. My name is Camellia. I am a psychiatric mental health nurse practitioner, also known as a PMHNP. I'm also a nursing and mental health enthusiast. And I'm getting on today actually in response to a question that I recently received. So shout out to Mahogany about collaborating physicians. And just sort of going through my previous videos, I realized that I've touched on this topic here and there in some of the other videos, but I've never dedicated a video fully to the topic of collaborating physicians. So thanks again for the question. I do want to expound upon some of the ins and outs of what to expect with the collaborating physician. Where do you find them? When is it necessary to have a collaborator? All of those things. And then, of course, as I always endeavor to do, I'll share some tips at the very end of the video to really talk through some things that I found useful when it comes to a collaborating physician. Okay. So first of all, the question of when is a collaborating physician required? Now, this may go without saying, but if you are not in a full practice state, so a full practice state means that you can practice independently as a PMHNP without a collaborating physician. You are able to practice fully without that oversight. There are many states that are already full practice states. There are a few that are actually transitioning, are in the process of transitioning to a full practice state. But there are some that are still not full practice states and do require a collaborating physician. So when is it appropriate for a collaborating physician? Of course, by state regulations, the Board of Nursing regulations, if you are not in a full practice state, you will be required to have a collaborating physician, okay? When you have a collaborating physician, there are a few things that you can expect. One is that you're going to have something called a collaborating practice agreement, also known as a CPA in most organizations. That is actually documentation between you as the nurse practitioner and the collaborating physician. As a PMHNP, in most cases, the collaborating physician has to be a psychiatrist, a board certified psychiatrist, and you'll actually have in that agreement all of the scope of practice for you, the things that you can and can't do. And it starts usually from a general state level in terms of what you're allowed to do in that state as a PMHNP. And then many organizations, what I've found is that many organizations actually get more specific about additional things that you can and can't do as a PMHNP within the organization. So a lot of that's driven by policies and procedures with organizations, but all in all, once that collaborating practice agreement is established, yourself as the PMHNP and the collaborating physician will sign that agreement, okay? So that's really what you can expect there. And some have asked me about whether collaborating physicians are actually supplied for you. And in most cases, if you're working for a public large organization, such as a hospital, a clinic, those organizations do typically have psychiatrists on staff that are deemed collaborating physicians, okay? So just understand that depending on where you work, that may or may not be already established for you. Most of the large organizations, again, those physicians or psychiatrists that are on staff are typically also deemed as the collaborating physicians for PMHNPs and also for PAs, okay? There are times where you may be required to find your own collaborating physician, okay? So that's important because if you're working in a contract position or also known as a 1099 position, and some of the private practice organizations actually do require that you find your own collaborating physician, okay? Some of the telehealth companies also require this. So that's going to be important for you because, again, you still have to, if you're not in a full practice state, you have to establish that collaboration with a physician, a psychiatrist, And then you also have to establish that collaborating practice agreement. Even if you're working a contract position, 1099 position, or any form of private practice. Okay, a lot of private practice organizations are owned by psychiatrists and physicians, and so typically they would be servicing you as your collaborator. However, there are times where you may have to seek elsewhere. Okay. In those instances, what you can also expect is that the collaborating physician will be paid a certain percentage of each case or for the services that they provide, the oversight that they provide for you as a PMHNP. So usually that's negotiable, and that's something that is usually clearly stated with each job role. So as you guys are searching for jobs, do look for whether or not a collaborating physician will be provided for you. And that is a question also that you want to ask upon interview, especially if it's not clearly stated. Okay. But for the most part, what I've found is that it's usually clearly stated as to whether or not you have to provide the collaborating physician. Okay. A few tips around that. When you are looking for a collaborating physician, I would recommend that you just continue to develop and establish great relationships with psychiatrists, with providers that you work with in clinicals, and that you continue to sort of have that in your back pocket as a good resource. Okay. You never know when you're going to be moving to a different organization, a different job, that you're going to have your own supervising physician. But also, I would say if you're in a full practice state or not, what I've found is that it's a really good idea to have a good resource, someone that you trust, sort of there and available for any challenging cases or anything that comes up that you want to be able to ping from someone else. Okay, so it's always a good idea, whether you're in a full practice state or not, to have someone, a physician or psychiatrist, sort of on board that can help you with other challenging things that come up. I always tell people that you never know what you don't know. So it's important that if something does come up that you've not seen before, or that you're not sure how to handle, you're able to actually discuss with someone else, again, that you trust and who has experience in that area. Okay, so very important. I would say a few things to look for if you are having to look for your own supervising physician or your collaborating physician. Do definitely seek out someone who has experience with working with nurse practitioners. You also want to be sure that it's someone that you feel like you can ask questions to, and who feels like they're available to discuss cases, and who's going to be readily available and open to discuss cases, of course, when it's appropriate, with you. When needed. So those are just a few things that I want to sort of land here with related to collaborating physicians. If you guys have other questions that you think about after looking at this video, or maybe that you've thought about that I have not addressed in this video, you can definitely message me below the video. I'm also going to try and actively start creating a place for you guys to ask specific questions, because what I'm finding is that some of you are asking questions that are not pertaining to each video. And so they're generalized questions, which is great. I still can answer them. I have no problem doing that, but I'd like to sort of streamline it a little bit. So do look out for a post from me where I'm just going to be asking for any questions that you guys have. Anything you want to ask, I'll use that as a platform for you guys to ask other questions. But I'm hopeful that this short video is good for you guys to understand a little bit more about collaborating physicians, if that was not clear to you, or maybe just expounding upon some of those areas. Again, if you have other questions, let me know. But I look forward to seeing you guys in the next video.